Hey, everybody. Good afternoon, evening, whatever time it is that you're watching this. A big hello to you. It's Dr. Tamara Beckford with Your Caring Dogs, our telemedicine urgent care. We help our small businesses and their employees, family get seen really quickly so they can get back to work. But every Friday, right here, we give you a medical topic. So we explain it so you can understand what's going on, so you can make some great medical decisions, right? So today's topic is congestive heart failure. CHF, heart failure. Those are some other terms for it. Congestive heart failure. Now, why am I going over this? We've actually been going over a couple of topics on the heart. And, one thing leads to another, leads to another. So I figure if you're already watching and you're already learning about things like the heart attack and you learn about the uncontrolled high blood pressure, all of this can lead to congestive heart failure. So why don't we just learn about congestive heart failure? Let's get started, right? Okay. This part might be my little challenging part, but we're going to get it right. We're going to share our screen and then we're going to get started. So let me go on to share my screen. And here we go. Boom. I hope all is going well today. So, like I said, we're talking about congestive heart failure. Now, the biggest thing that, we need to do and we need to know when we're talking about congestive heart failure, what is congestive heart failure, right? So, as we keep talking and we keep saying the heart is a pump. As much as, it does so many intricate things, and one of its function, it is a pump. So, it's a pump. And so we need it to work, right? That pump needs to work. So we have a left and a right side of the pump, and it needs to work. So congestive heart failure is the inability of that pump, that heart pump, to pump blood effectively through the body to meet the body's needs, right? So the body needs all of that blood, oxygenated blood, but the pump is not effective enough. That's what's congestive heart failure. I'll go a little bit more in details as to some of the effects when this pump is not pumping properly, right? So when we have the congestive heart failure, you're going to see here, you have a normal ventricle. So the ventricle are at the bottom, and that's really what's pumping the blood. So we have the right ventricle. So that's kind of like the intake, right? If you think of the heart as a factory, all of the empty trucks and stuff's coming into that right ventricle, right? So that's the deoxygenated blood. So that's the blood that went out and did its thing, got rid of all of its nutrients, and is coming back to get some more supply. So that comes in through that right ventricle. And then right atrium to the ventricle goes over now into getting its supply into the lungs. Lungs gives it its oxygen. Alrighty, good. Now I'm filled up. Go into that left ventricle, which is now, boom, trying to push it and shoot it through into the body, right? So that left ventricle needs to be nice and strong because we need to get it out of the heart and shoot it to the body so we can get all our oxygen and nutrients in. Now, when we have congestive heart failure, one of the things that can happen is that left ventricle, it's just not strong enough, right? It can't really pump that blood effectively. So if it's not pumping effectively, then a lot of that starts to back up. Now, what are some of the reasons as to why that pump is becoming ineffective? One of the reasons, as you can see here, is that the muscles along that ventricle can become enlarged. When that becomes enlarged, the chamber to fill up with blood, you have a smaller chamber. If you have a smaller chamber, you're not able to push enough blood through, right? So that's one of the things that occurs that can cause the congestive heart failure. We're going to go through a couple more things, right? So we have coronary artery disease and heart attacks. Now, if you think about the heart too, along the outer portion of the heart, we have our coronary arteries, right? So if you have a heart attack or blockage in those arteries, then that part of the muscle becomes weak, right? If you have a heart attack, that muscle is scarred. If it's scarred, then it's not strong and it can't really be an effective pump because areas of it is scarred. You ever had a pump and then part of it is just a little bit jacked up? That's what's happening right there. So it can't pump effectively because of the scarring to the tissue. And then you have high blood pressure. Now, the high blood pressure can lead to what we just talked about, which was that muscle becoming so enlarged. Now, let's think about this, right? Now, when we go to the gym and we're lifting all that weight, we're not lifting all that weight in order to stay small, right? You're lifting all that weight and you're lifting it against resistance. And each time you do that, you start to build up that muscle, right? And the muscle starts to become enlarged, which is what essentially you're looking for, right? You're looking for your guns, like, yeah, trying to build up my muscle. Now, in the heart, when you have high blood pressure, the heart is constantly pushing, that left ventricle is constantly pushing against that pressure, which is that resistance that we talked about. And so the muscle starts to just get enlarged, right? And as we said earlier, when that muscle becomes enlarged, the area of the ventricle gets less, and the muscle doesn't become enlarged and becomes more effective. It actually becomes less effective, right? So that's one of the consequences of that uncontrolled high blood pressure causing congestive heart failure. And we talked about damage to the heart muscles, that cardiomyopathy. So you're pumping consistently. Cardiomyopathy is essentially cardio is the heart and myopathy is the muscle. So it can become damaged, enlarged due to the constant pushing against the pressure, and that's one of the things of cardiomyopathy. There are other things, but that's one of them. Now we talk about myocarditis. So myo, as we said before, is the medical term for muscles. Cards is the heart. Itis, as we've said multiple times, anything that ends in itis is an inflammation of whatever the word before it was. So myocarditis is an inflammation of the heart muscles, right? So how does that occur? That occurs due to a lot of times, most of the time, are viruses. So the viruses gets within the body, and then not everybody, but for some people, it can cause an inflammation to that heart muscle, and so the muscle becomes weak. And of course, we're in the pandemic. COVID is a virus. It is one of the viruses that can cause myocarditis. So myocarditis, the muscles become inflamed, the muscles within the heart inflamed, and therefore the heart becomes an ineffective pump. So it's not pumping as well, and that's one of the causes of congestive heart failure. And then some people are just born with valves that are just defective. So when we're pumping, the pump is pushing, and then it's pushing the valves, right? So the valves are supposed to be a one way. You're supposed to open up and boom, close so that we're not getting any flow back, right? So if your valves are defective, it's not closing properly. Sometimes you can get flow back, and the heart is pushing constantly against that, and the heart becomes weaker and weaker. And that's another cause of congestive heart failure. So now when you're doing you're having congestive heart failure, we're talking about the heart is an effective pump. Therefore, you start to have some symptoms after a while, right? So some of the symptoms of congestive heart failure, one of the most common symptoms that people start to notice is that they become short of breath. So you become winded and, you're unable to really breathe that well, or if you're moving around. And one of the reasons when we talked about the blood coming in, the deoxygenated blood coming in, right? Ventricles pushing it up to the lungs, right? Lungs delivering the oxygen, like, yeah, let's get you some oxygen up in that blood. Now let's send you off over to the left side. So we bring you over to the left ventricle. You have all your oxygen, and the left ventricle is pushing, and it's an ineffective pump. What's the next place? If it can't push it forward and the pump is not going well forward, then some of it goes backwards. And the backwards part is where? That's the lungs. That's where it was coming from. Because the lungs is like, hey, let me shoot you off over, to the ventricle. Ventricle, I need you to send this out, into the body. The ventricle is like, I'm trying, I can't really get it. Then it starts backing up into the lungs. boom, starts getting some fluid building up in the lungs, and then that's when you get the fluid buildup and you get that congestive heart failure. So actually, I'll just skip ahead just for a little bit so that you can have a visual of what's going on, right? So this is your normal chest x-ray. We did a chest x-ray before. So the area that's black, that's, where the air is. That's how it should be. If you also look at this chest x-ray, you see the heart, you see the heart muscle, the borders of that heart, right? And this area is black because this has nice air that's flowing. So this person, they're not having any breathing issues. They're good, right? Now, if you have congestive heart failure, and we just talked about that fluid, boom, is backing up like that backflow, and headed back into the lungs, then you start to have some fluid building up and it starts looking like this. Now, that cephalization of vessels, big fancy word. Cephalid is basically the head. It's a medical term for the head. So it's saying that these vessels, you're seeing it's moving upward, filling up, going towards the head area, right? So it's filling upward. That's basically what cephalization means. Okay, that's congestion is filling upward. Then you hear pleural effusion. Pleural is area around each of these are the lobes of the lobes of the pulmonary area, so our lungs, and there's 3 of them. So what's going on right here is that there's so much fluid that's building up, that is building up in between the layers of the middle and the lower lobe of the lung. That's it right here. That's the pleural effusion. So this person is having shortness of breath. And even look at that heart. Look at that heart border. Look at that heart border. Look at this heart border right here, right? And look at this. So we talked about that congestive heart failure because the heart is pumping so much that now it's expanding and it's just large. That's what we're talking about. This right here. You see? The heart is enlarged. And over here actually is where that left ventricle is. So when that left ventricle is just pumping and now it's getting enlarged, that's what we're looking at right here. So that's what that shortness of breath is. Because everything is starting to pump backwards, right? A lot of times people with congestive heart failure, they start to have swelling within their extremities. So they'll start noticing that my legs are swollen. They can't fit it into their shoes anymore. They start to have a lack of energy, start getting drained, right? Just drained. And one of the things too is that they have difficulty sleeping at night. Why? When you and I go to sleep, we're laying flat. You're laying flat. Now all this fluid is on your lungs. You can't lay flat, so then they start using pillows. 1 pillow, 2 pillows, 3 pillows to try to be as upright as possible. Some people, their congestive heart failure is so bad that they sleep in a recliner. And they just, they sitting up like this. Because if they lie down, they're short of breath. So that's one of the symptoms. And then some people, the swelling starts to go around the outer portion of their stomach. You'll start to notice that they're having swelling around that area, and they have the wet cough. And when they cough, they spit. It's a frothy type of sputum. So it's frothy and it's pinkish, and it's coming, from the lungs. Increased urination, confusion, and then they gain weight. You gain that water weight, so they're checking their weight. And yeah, I've gained 10 pounds within the last 2 days. That's that water weight, that's that water weight. So that's what you'll notice with some of the symptoms of congestive heart failure. So we went over this x-ray already. So now, the classification of congestive heart failure, they have 2 different classifications. We're going to go through just the New York Heart Association one, right? Because we don't really have like 1 hour, 2 hours to go through this. I want to make sure that I keep you guys engaged and, you stay focused. So we'll just go through one of them. So the New York Heart Association classification, they have 4 parts to it, right? So part 1, you've been diagnosed with heart failure, but you're not having any symptoms, good, right? Then part 2, or stage 2, essentially. You've been diagnosed with heart failure, But you can do your daily activities, but if you start to exert yourself, then you start having that shortness of breath. Your daily activities, you can get up out of bed, you can, maybe take a shower, brush your teeth and put your clothes on, but if you're trying to go upstairs with laundry and trying to do all that, then yeah, you feel short of breath with that. Now, stage 3, you're very short of breath just doing daily activities. Like you can't even just bend down and put your pants on. We start feeling short of breath. Brush your teeth, and you're just like shortness of breath, right? Then you have like stage 4, that you're just short of breath, even just sitting. It doesn't even matter. You're not exerting yourself. You're not doing anything. You're just short of breath. So that's stage 4. So those are the classification. Here is a pictorial classification of what we just talked about, the 4 stages of the congestive heart failure, right? So we said stage 1, breathlessness or tied with brisk walk, jogging, or flight of stairs, right? Jogging, brisk walk. So if you're at rest and you're just doing your daily activities, you're good. But if you start to like move around too much, that's what that's saying, right? Then you start to get your breathlessness, that shortness of breath. Now, we're at stage 2, comfortable when at rest. However, your heart races and you get breathlessness. Breathlessness is you're short of breath when you're walking the block or taking the stairs, right? And then we have stage 3, palpitations, your heart's racing because we need a supply and demand, right? So you start doing all this activity, the rest of the body is like, hey, you're exerting yourself, you're doing all this stuff. I need some blood with some oxygen. And your heart's like, all right, I'm trying. Now I'm trying. So it's going faster. It's like, okay, I'm gonna try to get that blood out to you. And that's that palpitation that you're feeling, right? So it's like, all right, I'm gonna try to get that blood out to you. And it's going faster and faster. Palpitation. Now, with this, it says you're having palpitation and tired with this simple task. Now, the average person, you and I, might have our heart racing when we're like running, right? If we're running and you're doing all this exertion and your heart's racing, that's your heart, that's the supply and demand. Now, if you're having it with just simple tasks, like you're just trying to get up out of the sofa, and then your heart starts to race. So supply and demand, just for that simple task, that you're at stage 3 of the congestive heart failure. And then stage 4, it says it's hard to breathe or do anything even while at rest, which is what we discussed earlier, right? At rest, you're just short of breath. You can't even do anything. You can't get up out of the sofa. You can't just turn left or right. And then your heart's racing to do simple activities. And anxiety comes in, right? Because your heart's just racing all the time. So those are the 4 stages of the congestive heart failure. Now, what are some of the management of congestive heart failure? Now, we've talked about that, right? Hey, this is what happens and causes congestive heart failure. Now, management is usually first line is to prevent congestive heart failure in the first place. So we said that you can get congestive heart failure if you have like a heart attack. So if you have a heart attack and that can cause congestive heart failure, the goal is to try to prevent you from getting to the point of having a heart attack, right? Lifestyle modification. So things that increase your risk for having a heart attack, such as high blood pressure, diabetes, coronary artery disease, blockage of those vessels around the heart that we talked about, those arteries that's supplying it, nutrients. If they get blocked, no nutrients there, muscle dies, muscle is damaged, congestive heart failure occurs. So we're going to try to prevent all that with lifestyle modification. So that's step 1. Now, if that does not help, then our next step is usually then you're doing medications to try to help. Like some people know of someone, I mean, you might know, family member, friend, somebody that's on a water pill. You're like, yeah, I'm taking that water pill. Another term for it is a diuretic. So basically, you're taking that medication to try to get some of that excess fluid off. We talked about that fluid that builds up and goes on the lungs. You're try to get some of that excess fluid off so that you can breathe and you can, have a manageable life, right? And then you have medications such as beta blockers, try to help the heart to beat a little bit slower so that it can manage, that pump. That pump is malfunctioning, so we're just going to try to slow it down so we can do the best as can, right? And then you have like some ACE inhibitors, but what that does is that tries to open up the vessels so that when the heart's doing its job, it's just trying, then the vessels are open so that at least throughout the body, it can get some oxygen. That exchange it occurs which is the reason why the blood is pumping through the body in the first place. Exchange of oxygen and nutrients, right? And then if that's not happening, then surgery would be an option. So surgery, if you have blocked vessels because of the coronary artery disease, is decreasing that flow to the heart. Next thing, let's try to open up that vessel. So that's one of the surgery that can occur. Another type is that you have done, trying to open up the vessels to the heart. Next thing is that, a heart transplant, or to can be another type of surgery. That's further down. If the valve is the issue we talked about, some patients unfortunately are born with just bad valves. Some people's valves eventually becomes, weakened and it's not working properly. Let's try to fix or replace the valve. So that's another way of trying to manage the congestive heart failure. We have ventricular assisted device. I actually have a picture of that here. So this is a pretty interesting device. I mean, I don't know if you guys can really see what's going on. Now, we talked about the pump of the heart, that left ventricle. That's that strong part that is pushing that blood through to get it to the rest of the body. If you look here, we know that the left ventricle, a lot of times, there with congestive heart failure, sometimes the left ventricle is malfunctioning, right? So this device is a ventricular assist device, and it says it there. It's helping the ventricle. So right here is that left ventricle. It's implanted here, and then it's bypassing that valve right here, and then it's pumping the blood right into the aorta. So it's acting like the ventricle itself and shooting the blood. So there's some patients who have the ventricular assisted device, and they walk around with it. It's called a VADS, is another term for it right here. VADS, the ventricular assist device. And we talked about heart transplant as another avenue to try to manage the congestive heart failure. So at times, if someone is not a great candidate for the heart transplant, that's when they'd use the VADS. And now, if all of this has occurred and they've exhausted all options, so everything that we've talked about right above there is done, and the person is still, getting worse and worse, because the thing about congestive heart failure is that it progresses. So it's not something that you're gonna get rid of. It's just once you diagnosed with congestive heart failure, and once you have it, the likelihood is that it's going to progress from one stage to the next, and therefore you try to manage it to prevent that from happening, right? Now, if all of that has occurred and you've exhausted all options, then unfortunately, what the next step would be to try to make that patient comfortable, right? So that's what palliative care is. So palliative care is a type of care to have that person who will eventually pass, but have them have a great quality of life during that portion. When I say eventually pass, doesn't mean they're going to pass tomorrow. No, the quality of life is because, as we said, at stage 4, you're sitting, and no matter what you're doing, you're still having shortness of breath, right? So someone like that, you would still try to use medications and everything, but you want them to have a great quality of life, right? And so palliative care, that's what that does. It helps them to have a great quality of life near the end of life. And so does hospice, and hospice is the next step after, right? So I hope all of this made sense. I know it was a lot, but you guys are smart. You're good. So, you can digest it all. And all of this information is available. So you can go back and look at it. You can explain it to your friends, your family. You can let them know what's going on, right? I hope this made sense. I know it did, because like I said, you're smart. All righty. So I'm Dr. Tamara Beckford. If you like this info, I want you to like it, share it. Leave a comment. Let me know what you think. I really, really, really do want to know. And if you have any topics that you want me to talk about, Put it in there. Put it in there. Let me see so I can go, and get it all together and present it to you. I look forward to seeing you guys next time right here. Bye bye.